restocking your supply of COVID-19 tests beginning on Monday. Households here can order 4 free kits through a federal website here, in the United States. Here to answer questions, Dr. Kristen Moffatt, an infectious disease specialist at Boston Children's Hospital. Great to see you, doctor.
Good to see you too.
Yeah, hi, Dr. Moffatt. You know, it's been a long time since some of us have even looked at our stockpile of tests at home, right? Probably in the closet. What are the chances that they're all expired?
Yeah, it's a really good point to bring up. It is possible that they are expired, so everybody should check the expiration date on their COVID tests. But don't throw them out if you see that the date shows that it's expired, because a lot of these different brands were doing sort of post-distribution testing to see if they were still effective beyond the expiration dates. And indeed, a lot of these expiration dates have been extended by somewhere between 6 and 10 months. So there is an FDA website that lists these expiration date extensions by brand. So I would definitely recommend checking that out before you toss any tests.
I actually did that, and they're all expired. So it's great advice. So let's talk about these new rounds of free tests, the website to order them, covidtests.gov. It opens on Monday. Why is this being offered now?
Yeah, I think it's great that this is being offered again. If you may remember, there was a time when insurance did cover this, or these were being offered at no cost. And they're expensive. When we go and buy these out of pocket at a drugstore, they're not cheap. Cases are rising right now. Hospitalizations have been rising, and it's conceivable in the coming months, as people spend more time together indoors, with holidays coming up together in the coming months, transmission could increase even more. And it remains true that testing for COVID, if you've got symptoms of COVID, and isolating if you're positive, is a really important part of keeping another surge from happening. So I think it's a great move to make these available again at no cost, so that everybody who wants them has access to them. I think it's also important to remember that we've got treatments available now, like Paxlovid, that we didn't have available a couple of years ago. And treatments like that are most effective if they're started as soon as somebody knows that they have an infection due to COVID. So being able to have tests at home and confirm that your symptoms are due to COVID, it's really helpful in a lot of ways.
Okay, and of course the virus, always keeps changing, because that's what viruses do. This one has changed a lot over the years. Any concerns about new variants down the road, or testing of any of that?
Yeah, it's a great question. It always would be of concern. We want to make sure the tests we have, if they're negative, can we trust them? And this is something that the FDA and other agencies are regularly and systematically doing for all of the authorized tests. There have been some instances of tests that are not the ones as broadly available, where their performance has been decreased with some of the variants. But it's really important that this continues to be monitored. For the most part, the ones that remain broadly available have not exhibited any decreased performance with variants that have emerged over the last couple of years. But this is something that needs to continue to be evaluated.
All right, Dr. Moffatt, thank you so much for spending some time with us. We appreciate it.
Absolutely. Good to see you.
Thanks. Stay well.